Hi, I'm Dr. Ronald Fielden.
I'm Dr. Michael Golab.
And we want to welcome you to South Texas Non-Surgical Spinal Center.
Dr. Fielden, what types of conditions do you specialize in?
I have really been interested in disc herniations. Disc herniations are probably one of the most serious injuries you can have that you see in the chiropractic office, and so many of them result in back surgery. And in back surgery, so many of those surgeries fail, and to the point where patients have had 2 and 3 back surgeries, and then the surgeon tells them, "I'm sorry, we can't help you." And I see so many of these patients in my office who have been kind of left behind because there's nothing else that can be done. And the key is to get them into chiropractic care in the beginning, in the onset of the problem. And we have such great success with disc herniations if we can approach them with a more conservative type of treatment with chiropractic care, with spinal decompression, with exercises, and all of these things we incorporate when we take care of a person with disc herniations. It's just not a one-facet approach. You do have chiropractic, you do have decompression, you do have corrective exercises, and those things in combination are what truly are a positive effect to a disc herniation.
Dr. Fielden, you've mentioned failed back surgery cases. Is there anything that can be done to help these people who have been through surgery and are still having a lot of problems?
There are, and it depends on the type of surgery they've had. For example, if they've had a full spinal fusion, then certain things we use like spinal decompression are not an option for them. They're more in the realm of chiropractic manipulation around the area, stretches and exercises to stabilize their back, and those can have very good results with the chronic pain that these patients are having. The ones I really enjoy are the patients who've come in with a more conservative surgery like a hemilaminectomy or a discectomy where there's no fusion taking place. With these types of patients who've just had shots and minor surgeries like that, we still have a lot of tools on our belt to help them, including our best option is spinal decompression. It is low force, low impact. It's a very gentle procedure but very effective in treating disc herniations. And anybody who has had a minor surgery and has good bone density and no major cancers in the area is a good candidate for this type of procedure.
Dr. Golab, what types of conditions do you see the most?
In this practice, it's mostly low back, chronic disc pain, facets, which are the joints of the lower back, but really the herniated and bulging discs, which cause severe low back pain and leg pain.
What types of treatment do you use?
We use chiropractic care, of course. For the discs and all that, it's mostly the DRX 9000, which is the most advanced decompression table out there. We also use various physical modalities to help patients like electrical stim, microcurrent, as well as cold laser therapy, which is a very, very advanced therapy for patients for soft tissue injuries.
What would you say is different about how you approach patient care as opposed to others in the field?
Tell them straight up what they need. Not everybody is on the same program. It's not this, times 6 people. They all get different customized treatment plans, and it's all individually tailored to your problem.
Dr. Fielden, are you able to help older individuals, people 70, 80, or maybe even older?
Absolutely. We have many patients in their 70s and 80s, and as long as they have good, decent bone density, and that can be easily determined with a bone density study, as long as they have decent bone density, they should be fine as far as the spinal decompression goes.
Can you tell us about your commitment to getting good results quickly?
As I stated earlier, I started out as a sports chiropractor, and when you're in that field, the bottom line is results, and results quickly. And so I approach my everyday patient like an athlete. I think every patient should be afforded the opportunity to get better faster. And when a patient starts seeing results, they get excited and they do the things they need to do, such as their exercises or icing or stretching, whatever we have entailed them to do at home. So I am more aggressive in my treatment, getting the patient better faster. I build my business on getting a patient well, and then more importantly showing them how to stay well with exercises and home instructions, so that they go out and they tell their friends and family, hey, this doctor not only made me feel better, but he showed me how to stay feeling better without having to come to his office multiple times a week.
Now, you are a doctor of chiropractic, and I can imagine that somebody having a lot of back pain from a disc or something like that might be a little concerned. What would you say to them if they are worried about the treatment being painful?
The nice thing about the DRX 9000 is that it is very low force and very non-invasive treatment. There's no cracking, there's no wrenching of the back. It's a very gentle procedure, and matter of fact, most of our patients sit and watch a DVD while they're getting treated for the time they're on the DRX. Frasier, Friends, Raymond, any of those DVDs, and we hear a lot of laughing coming from the room as they watch their DVD. It's a very gentle treatment, and those people out there who are hurting, who are afraid of having their backs twisted, this is certainly the type of treatment that you're looking for. It's a very mild force treatment.
Dr. Golab, how is insurance handled in your office?
Actually, this is my wife. My wife actually does all the billing, and she's doing the slaving and re-verification of insurance benefits, etc. But we are in network here at the office with all the major carriers and the minor carriers, to include Medicare. As a courtesy to all our patients, when they come in, we verify all the coverage so that before they start any treatment, they will know what the responsibility is 100%, whether how much they're going to pay and how much the insurance company is going to pay. But most people just want to, see if we can help them here at this office.